वेलकम टू दिस चैनल माय डियर फ्रेंड्स। आप सबको हमारे इस चैनल में बहुत बहुत खुशामदीद। और आज से पहले मैंने ये वादा किया था कि आपको होम्योपैथिक प्रिस्क्रिप्शन किस तरह से होम्योपैथी में इंतखाब होगा, दवा किस तरह से सेलेक्ट होगा, उसके कुछ प्रोसीड्योर हैं। उस प्रोसीड्योर को होम्योपैथिक में रुब्रिक्स और रिपर्टराइजेशन के नाम से जाना जाता है। तो व्हाट इज रुब्रिक एंड व्हाट इज रिपर्टराइजेशन? तो किसी भी केस में किसी भी पेशेंट का सबसे इम्पोर्टेंट जो काम है फिजिशियन के लिए वो ये है कि उसका हिस्ट्री मालूम करना, हिस्ट्री टेकिंग। So in spite of all those common things, name and other thing, is suffering is important. उसके साथ उसका क्या शिकायत है, उसकी क्या तकलीफ है, उसको नोट करना, उसको मालूम करना, उसका इंक्वायरी करना, ये सबसे इम्पोर्टेंट। और इसको दैट हनीमैन के मुताबिक ये एक आर्ट है। तो आई एम कमिंग टू द पॉइंट, द आर्ट ऑफ केस टेकिंग एंड repertorization. So in the homeopathic practice, most important portion of this practice is taking the history of the patient. In that history, we have to take note of his important problem and his suffering and his ailment and the diagnosis. Apart from that diagnosis, for the selection of homeopathic medicine in homeopathy, for each character is required, and based on that character, that is called the rubric. And in that rubric, there are so many medicines come under that particular rubric, and with that medicine, according to the totality of symptom, one of the medicine is the selection, and that is the selection of medicine in homeopathy. So first of all, taking note of general common symptoms, which is most concerning for the patient or the ailing person. The second part is taking the symptom which are rare and extraordinary. ये दूसरा part है। The rare and extraordinary means for that the patient does not give any importance, and it is not so serious for a patient or the attendant, but it is a choice of the physician, and it helps in the selection of the medicine. So this symptom may be either physical or mental or psychological or in dreams, or is aggravation or amelioration. कब वो अच्छा महसूस करता है, कब वो जो है ज़्यादा तकलीफ महसूस करता है। तो ये जो अग्रावेशन एंड एमिलियरेशन है, ये ऑल्सो दिस इज ऑल्सो ए वेरी इंपॉर्टेंट पार्ट इन द सिलेक्शन ऑफ होम्योपैथिक मेडिसिन. So now in this category there may fall, according to rubric, many medicines, and in that account, out of all those medicines, we have to take the characteristic symptom. So suppose I give you example of a common thing, diarrhea and dysentery. Earlier also told you in the thirst is a factor. So based on this thirst, medicine is selected. In case of diarrhea, people they suffer from peculiar type of thirst. People they are thirsty, but we have to characterize this thirst. Some people they take water, a small quantity of water, and they perspire, and their face is very much dehydrated, and thirst is very much intense. So he takes a small quantity of water, and this taking a small quantity of water lead us to the selection of arsenic album. इससे arsenic album क्या character का पता चलता है, and arsenic album is important medicine for diarrhea or cholera, or it may be, but the important factor is the thirst. So in another case, if he takes a large quantity of water and every time a bulk quantity he takes, and as soon as the water goes to his stomach or anything, even food or water is not tolerated, he starts vomiting, and that character lead us to the selection of China officinalis. So in this way, these things are characterized, and this is called the repertorization. And with this repertorization, if the repertorization is correct and to the point, we will succeed in our selection, and we can help the patient to recover from his ailment. This is the criteria for the acute disease. But in the chronic cases, in case of a chronic disease, there is the selection is little hard, and we have to take care of many other things. Is dream, is psychiatry, is living condition, habitat, all those things, and the period for which he is suffering from that particular disease, and what has led to that disease. The inquiry should be the history of his future condition. So if we go to the future condition, it will lead to some very important mathematic selection, and we can diagnose the mechanisms behind the disease, that chronic disease. And once the mechanism correctly selected, in the medicines can be selected based on that mechanism, and he can be cured. Patient can be cured. So that is the selection of medicine. So in short, this is what I precisely gave you the process of selection of medicine according to the homeopathy. Inshallah, I will try to give light on some other aspect also in this field, apart from the selection, the potency and the selection of higher potency or lower potency. That also very meaningful. Inshallah, I will continue with further my videos.